Why I fear what my asthma inhaler's doing to my health. Drive ESCA reveals procedure that can help, and the risks users need to know. Let's decode this. Headline: without the scare factor fog creeping in. What your inhaler is actually doing. Most asthma inhalers fall into two main types. Reliever inhalers, usually blue, like sabutamol, quickly relax airway muscles so you can breathe easier. Preventer inhalers, often brown-orange, contain low-dose steroids to reduce inflammation over time. A very common one you might recognize is sabutamol reliever. These aren't harming you when used correctly. They're keeping your airways from behaving like overdramatic theater curtains that slammed shut at the worst moment. The concerns behind the article. Doctors like Dr. Martinska often highlight that long-term inhaler use can have downsides, especially if not monitored. Possible issues. Overuse of reliever inhalers can risk worsening asthma, linked to higher risk of attacks. Steroid inhalers, long-term, high-dose. Oral thrush, fungal infection in mouth. Hoarse voice. Small risk of bone thinning with prolonged high doses. General point. If you rely heavily on relievers, your asthma may not be well controlled. The procedure being talked about. The article is likely referring to bronchial thermoplasty. What it is: a hospital procedure using heat to reduce excess muscle in the airways. Fewer muscles equal less tightening during asthma attacks. Think of it like turning down the overreaction dial in your lungs rather than constantly fighting the symptoms. Risks of that procedure. It's not a casual fix. Temporary worsening of asthma right after treatment. Risk of infection or inflammation. Only used for severe asthma that doesn't respond to medication. So it's more of a last resort upgrade, not a replacement for inhalers in most people. The honest bottom line. Your inhaler is helping far more than harming if used properly. Problems usually come from over-reliance on relievers, incorrect technique, not reviewing treatment regularly. The new procedure is only for a small group of severe cases. What matters most and rarely makes headlines. Using your inhaler correctly technique matters more than people realize. Having a preventer inhaler if needed. Regular asthma reviews with your GP or nurse. If you want, tell me what inhaler you use, name or color is fine. And I'll explain exactly what it's doing in your body and whether anything needs tweaking.